I'm a leader with MDClone, and we really focus on self-service data analytics. So data exploration is actually how I like to talk about it, because I grew up as a programmer and a report writer. And this isn't exactly that. It's a little bit cooler. So the company is based out of Israel. It started in Israel in 2016, and I am one of the leaders in the North American office. And I've been really excited to be here at HIMSS and excited to talk to you.
Yeah, amazing. And I saw the impressive booth down the end there, and lots of interesting conversations. What's the vibe for the conversations here at HIMSS for MDClone?
It's been super exciting. So we launched a generative AI feature capability where you can have something, what we call AI yet. Or is it a boy? Is it a girl? Who knows?
We should assume no.
Right, it's a person. But we have Adam is his name, so I guess ours is a boy.
Yes.
And Adam knows all the data science-y stuff. So like if you're not a statistician, you don't know how to, publish a research study, but you heard something about this, P statistical test. Well, ask Adam to do it, and then you can even ask him what it is, and he'll tell you about it. So it's kind of cool, research assistant.
Yeah, and so is it geared towards the research side, or for clinicians, a little bit of both? Like, who are the key users of the platform?
That is a great question. So our users are clinician nerds. So they're the nerdy clinicians that want to touch and feel their data.
Yeah.
Sometimes have to stand in line with IT or something like that. Our IT folks and our clients like us as well, because we relieve some of the burden on them and allow them to focus on some of the, higher level operational type things. But you have all of these clinicians across your health system usually that have really cool ideas. And the ones that want to try to find the answers and want to play with their data, they're just popping with ideas every single week. And they usually have like some friend in IT that's like at their beck and call all the time. So we like to go to these, nerdy little clinicians and say, here, you can work really easily in this tool, and they can touch everything. Multiple sources of data. They can create time correlation type questions in the system and pull data out and then go analyze it. And so when you ask, who's our user, it's the clinician nerds, right? It's the clinician data guys who want to get in there. But really, it's the health system in terms of, you think of like GoFundMe and crowdsourcing, right? Where you can make it better and do more of it if you source it out to everyone.
Yeah.
So instead of having this tiny funnel supported by a lot of programming and extra technology, we essentially put it in the hands of all of your thinkers. So every great idea that someone has, if they want to try, they can just go try to prove it and see if it's worth it. And then they can either discard it or move on. So it's all about driving more volume, those ideas, and ultimately more value for the health system.
Interesting. So from the health system point of view, like the return on investment on the platform isn't just to keep the nerdy doctors, occupied.
Yes.
It's more so about it creates an opportunity for innovation, new ways of doing things. Like, what's the real driver for the health system to invest in a platform to do that kind of stuff?
So much. It depends on what you're interested in, right? So research is one area, and we have customers who have gotten millions and millions of dollars in grants using our platform to help prove out. Now, it's their ideas, right? We have clinicians on staff, but we don't bring the ideas so much as we can share what others have done that have the platform. But they wanted to apply for a grant. We were able to help them move that faster and get there faster. But research isn't the only piece. It's probably the one that we started in here in the U.S. when we jumped over here. Population health has some great applications. And Intermountain won the Infram Award and the Davies Award the last year or two here with HIMSS. And one of the things that they focus on is improving outcomes for their patient population. So they've got some great studies on pulmonology and chronic kidney disease and things like that. And they're using our platform to help drive insights faster. And, one project, I think in one situation, they were able to start a new medical service around an interventional treatment that they had come up with. And it worked really well. And I think that's one of the ones that won them the Davies Award. And they brought in revenue, millions of dollars revenue on that, because they were able to open up, I think, 5 or 6 additional centers that were doing that treatment. So there is a lot of value, and the system kind of pays for itself, tenfold. But the value doesn't come from the system by itself, right? The value comes from all those great ideas that you're now allowing to, rise up to the top.
Yeah, got you. thinking then from a health systems point of view, having the a tool like this to be able to make sense of the data and perhaps demonstrate a particular outcome and take action on that, that sounds really cool. But, you know, in healthcare as well, there are many systems that have messy data or not you know, digital data.
Yeah.
And you kind of, do you need that baseline firstly before you can even get out of the gate in utilizing your platform? Like, where does that, where do you position yourselves in this current landscape of messy, is uninteroperable a word? But yes, you know where I'm coming from.
It is so messy, and we love a good mess.
Yes.
So we have the best janitors ever.
Right, got it.
Just to
nice.
play into the analogy. So that's where really the super talented people at MDClone come into play, right?
Yes.
So, and I am not, you know, personally one of them. I talk about stuff. You don't want me. I programmed like 20 years ago. You don't want me doing that anymore.
Yeah.
But we've got some really, really smart individuals that they focus on data quality. And so assumptions in your system, like how do you actually document the date of death if the patient didn't die in your health system, right? That could have a big impact on some of the studies you're doing around, you know, end of life or something like that. So we've got, we always work with the hospital in terms of like business assumptions and things like that. But our teams are really, really good at taking statistical and data science approaches and applying them to that messy data. And we actually help hospitals and health systems uncover a lot of messy stuff and come up with, okay, how are we, like, what's our standard rule going to be when we bring these together? And so there's a lot of healthy conversation that comes out of that as part of the implementation, but it doesn't scare us.
Yeah.
We jump in, all the sources. We've got customers on pretty much every major EMR. We've got many customers that are on multiple of the major EMRs. And then there's your outside lab system or your costing system or other things that we pull in. So we love the messy data. We do need it normalized in order to do what we do, but that's part of the service we provide. And we actually, that's probably really a differentiator in our world, is our ability to make it feel normal. So a layperson, a clinician, a nerdy doctor can get in there and just play at his playground.
Interesting. Well, if you love the messy data, you're in the right place in healthcare. So it's you can. And one thing I was thinking too is did you say the company originally out of Israel? Is that right? So you've got a bit of a global view. Is that right? Are you finding that there's some interesting synergies that you can pull from a global perspective as well?
Oh my goodness. Everyone has the same problem. 100%. It's a global challenge. The U.S. is a little different because the U.S. obviously has privatized healthcare in addition to the public. And, you know, it's hospitals are a little less standardized in the U.S., but then in other areas they're actually, you know, they're more thorough maybe in the digital space. We've got a pretty good digital footprint here in the U.S., obviously. But we have sites in Canada that are very focused on kind of collaboration and how do we do more for the broader population. We've got, you know, we started in Israel. Pretty much the whole Israel population is in our system. Now we keep it behind firewalls on the client side, so we don't like take the data and do things with it. But you can get to the entire Israeli population. So we work with companies that are interested in improving population health outcomes, and we help feed them information on behalf of our clients and with our customers. Sheba Medical Center is a great example out in Israel.
Yeah.
And they help drive a ton of research just for the betterment of mankind. So we love the global application. We are in multiple countries across the world, not just Israel and the U.S. and Canada. We have a few other areas as well.
Yeah, cool. Thinking as we're winding out to the back end of HIMSS now, and lots of interesting conversations and a bit of inspiration, but also a lot of challenges in healthcare that we've talked about a bit now. And also you've obviously spoken to clients and punters here at HIMSS. What are you taking away from this, and what can we look forward to seeing from MDClone in the coming months and years?
Yeah. So HIMSS has been fun this year. It's been really exciting. I've been to HIMSS many years, but 2 years ago it was all pop health, right? Last year it was all interoperability. At least this is my perception of it. This year it's all AI, right? Oh my goodness.
Yeah.
The underlying, and before that it was other things, right? The underlying theme and the challenge behind being successful in any of those spaces is data. It keeps coming back to data. And anybody you ask in healthcare will tell you that, and everybody knows that, and there's lots of different solutions out there. So it's really hard for providers to choose. We try to bring a little bit different spin on that. We're not looking to be the operational reporting tool for a system. We don't necessarily want to just tell you what's going on real time or otherwise. We want to help you figure out why things are happening, why they're going well or why they're not going well, so that you can use that to improve your patient population, your outcomes, your efficiencies. So, our focus is really that. And one of the things we rolled out last year is our ADAM Center concept, which is like a combination of governance with a hospital, additional services that can kind of be your coach and help you with some of this data analysis and data digging and data mining. And then kind of this constant feeding the funnel and driving value out of those activities. So you've got all of these innovative, nerdy little doctors, right, that want to get cool stuff done. And they may come up with the data and the idea, but then how do they execute it? So we're helping customers. We've got 3, I think, right now that we're working with, create ADAM centers so that you can have a hub within your health system that pulls all of those ideas in and helps lift them to the top of the leadership's view. Intermountain has done a fantastic job at this. Sheba was the first one to go live with this model, and we're seeing our customers get really interested in it. So that's kind of our momentum right now. And then what we're about to add to that and what we rolled out this week at HIMSS is our new AI capability, which is like an AI-powered research assistant. I talked a little bit about that a minute ago.
Yeah.
But, Adam, he's able to help you analyze your data. And in the coming months, and definitely, we're looking to next year potentially, but we'll be doing even more cool things with him. Like, what if you could use AI to just write that query and pull the data for you, not just analyze it? So we've got a lot of exciting plans.
Yeah.